All right. Hello, hello. Good afternoon, everyone. It's really nice to see you all. My name is Allison Elsner, and I'm the CEO of the San Bernardino County Medical Society. And we are so incredibly excited to be presenting this webinar today. This is the fifth in our series of 5 sessions, all about the Medi-Cal, Medicaid. Did I say Medicare earlier? I meant Medicaid process and what's coming down the pike and what you all can expect as a result of the implementation and the passage of and the signing into law of HR 1, the one big beautiful bill, and other ancillary factors, including the state MCO tax and Prop 35 and all of those things that are going to impact the coverage for our patients, as well as the amount of operating dollars that many of our organizations will be receiving and the cuts that can be expected in terms of Medicaid coming from the federal government. So with that, we want to go ahead and introduce our speakers today. And we first want to introduce James Locurto, who's the director for the Transitional Assistance Department with the San Bernardino County Department of Public Health. And then, or just with San Bernardino, right, James? Are you with Public Health or just with the county?
Yeah, thank you for that, Allison. Appreciate it. I'm actually with the Transitional Assistance Department.
Transitional Assistance Department. Okay, for San Bernardino County. All right, well, I'll get this right here. Thanks, James. And then also joining James today is Brent Steinhoff, who is a program specialist with County of San Bernardino, and he's with the Program Development Division. And he is our, as I understand it, a Medi-Cal expert for the state of California. So, gentlemen, we're really, really excited to have you here. We have a huge turnout, and we're going to go ahead and turn it over to you and do questions at the end. So, take it away.
Wonderful. Thank you again, Allison. Really appreciate it. And team, happy Wednesday. Good afternoon. Again, my name is James Locurto. I'm the director for the Transitional Assistance Department. Super excited to be here today. Allison did say that we typically hold the questions to the end. If you want, you can put those questions in the chat. Allison, real quick, just some housekeeping. Are they able to come off audio and answer or ask a question? Okay, wonderful.
Absolutely. And we encourage it, folks. This is interactive. So let's, if you want to ask the gentleman something, please do, because we want to get these questions answered. So, yes, indeed, James.
Yeah, really appreciate that. So team, as Allison said, let's make this interactive. If you have a question, go ahead and raise your hand. I have brought the Mr. Brent Steinhoff with me. Brent is well known throughout California. I'll have him introduce himself here in a second before we get started, but I always like to share a little bit about myself personally. I've been with the county almost 30 years. September 23rd, 1996 is when I started. So I'm saying 30 years, even though I'm 29 and a half years in. I think I'm close enough to go ahead and round up to 30 at this point. Love what we do here, folks. Love it. Love it. All 29 and a half, 30 years. I really appreciate the opportunity. I feel very blessed to be able to work here for the department and for the county. Important work that we do here to support our community. On a personal note, I have a super amazing wife, and we're blessed with 3 beautiful kids. I always overshare about my kids because I'm just that person. Got a beautiful daughter, 10 years old, Victoria Rose, and I got a 9-year, almost 9, excuse me. James Vincent's going to be turning 9 on Monday the 30th. And then the baby of the family, John Louise, can't do anything wrong. He is 7. So super excited to be here. Brent, you want to go ahead and do a quick introduction?
Sure. My name is Brent Steinhoff. I'm with the Program Development Division. I specialize in healthcare programs. Much like James, I've been with the county for a long time, not quite as long. I've been with the county for 26 years. I did start in the program or in the Transitional Assistance Department as a line worker, and I've worked my way up through and am now doing policy. So I've been in policy for 13 years at this point. Started with the main thing I came into. I had to figure out the years. It was with ACA, and have been hot and heavy since then.
Wonderful. Thank you, Brent. Appreciate it. And again, next slide, please. Let's have a great afternoon here. Let's have a great next hour and some change that we're going to be spending together. A little bit about the overview, what we're going to be tackling here. We're going to touch on the critical programs that we administer here in TAD. We're going to spend the bulk of our time talking about the Medi-Cal policy that's started to be implemented January 1st of 2026 and have implementation timeframes through 2028. We're going to talk about some outreach and communication, as well as some resources and tools that are available to you, as well as the community that we serve, and our customers. And then we say questions, but again, let's pepper Brent with a lot of questions throughout the presentation, and let's see if we can stump him with some very technical and difficult questions. So next slide, please. Mission
Challenge
statement.
accepted.
Yeah, please
Challenge
do.
accepted.
And
Okay.
typically, if this was like a presentation in front of staff, I would offer you, something, a Jersey Day or something, a Jean Day or something like that, if you can stump Brent. But it would just be super awesome to see if you can come up with a very technical question that Brent doesn't know. But anyway,
Okay, got it.
I am not going to go over and read the mission statement, but I do want to just highlight that, as you know, San Bernardino County is huge. We have over 20,000 square miles makes it incredibly unique, right? And we're going to talk about this throughout the presentation, is that with significant changes happening at the state and the federal level, it really does require this village. It requires everyone to come together and collaborate. And that's one of the key words in that mission statement, is working collaboratively together. Really leaning on everyone to come together to support our community with these significant changes that we're going to be grappling with over the next 2 years. Next slide, please. A little bit about ourselves. There are 3 big programs that we administer here in TAD. We get the CalWorks, CalFresh, and Medi-Cal program. CalWorks is for our folks that are either pregnant or have a child within their house. This is our cash-based program. CalFresh, food and nutrition program. I always, when we talk to new staff and folks that are joining the department, I always say, again, how much I always value and appreciate and grateful to be in a position to help our community. But in particular, we talk about the CalFresh program and our Medi-Cal program, and talk about health coverage. Every single individual, if they need healthcare coverage, they should be receiving it. And every single individual, if they need food and nutrition assistance, they should be receiving it. No one should be discontinued for technical procedure-related reasons. And I'm sure that everyone on this Zoom meeting here this afternoon would stack hands with me to say that there should be no one within our nation, in particular within our county, that should go hungry. There should be no child that should ever go to bed hungry, and there should be no parent that should ever have to sacrifice not having dinner because they need to feed their little ones. So when we talk about the programs that we administer here in the county, they are super, super critical. And again, it's a blessing to be able to be in a position to help our community with these 3 major programs. Next slide, please. And this one here, team, I wanted to just put together a quick, and I do have some more. Let me get you the current numbers. I asked for some new numbers the other day. Just for context, y'all probably know we have about 2.2 million people that reside in San Bernardino County. And again, for context, just sharing the volume of cases, and this is cases that I'm going to first initially share with you. These that are showing on the slide deck, they're as of January 2026. I'm going to share with you some new numbers that we just got for the CalWorks program. And I'm going to give you both cases and individuals. So the number of CalWorks cases that we have a little over 28,651 to be exact. And then the number of individuals receiving assistance is 93,177. For the CalFresh program, we currently have 186,201 cases. As far as the individuals, we have 663,717 individuals. And then for Medi-Cal, 429,002 cases. And then for the person count, it's a little over 800,000 individuals. So when you start adding up the total number of individuals that we are serving here in the department, we're well over 1 million of the 2.2 million that reside in San Bernardino County. Also provided just the number of folks that are coming in seeking assistance. And this is not the number of folks that are applying. This could be folks that are coming into the office because they need a new EBT card, they need a new Medi-Cal BIC card, they have an appointment, they are applying, they're there for recertification, etc. But just to give you an idea, the number of folks that are coming into our 19 public-facing offices, a little over 4,300 on average. That is, again, an average. We do spike, like at the beginning of the month next week on the 1st, 2nd, the 3rd. We will see that number go over 7,000. I've seen that number go over 8,000 at certain points, but we also see it drop and dip into like about 3,000-ish or so. But on average, about 4,300 customers are coming into our office looking for some type of assistance. Next slide, please. All right, cool. So the Medi-Cal program itself, and probably all information that you know, but it's kind of setting the stage leading into the policy updates. Just wanted to make sure that we had a good foundation of the Medi-Cal program and the services that it provides. Again, we're looking at providing comprehensive coverage for low income Californians. The comprehensive health benefits, they address and cover preventative care, hospital care, prescriptions, vision, dental, and mental health. There is a flag, and we're going to talk a little bit deeper about this later on, but dental services are being removed for certain individuals who do not satisfy or meet the satisfactory immigration requirements. And that is as of July 1st, 2026. And again, we'll talk a little bit more about this at a later slide, but wanted to kind of flag that for you right now. As well as that we have four managed care plans, MCPs, in San Bernardino County. We have IHP, we have Molina, we have Kaiser, and then we have SCAN as well. And I am not tracking if there are hands being raised or if there are questions in the chat. So Brent and Allison and team, I appreciate that you are monitoring that. Next slide, please.
Yeah, we'll monitor that, James. Don't you worry about it.
Cool, super awesome. We're on the Medi-Cal policy update. So again, there's two different kind of buckets here. We're talking about the state policy changes that are really being driven off of budget decisions, and then we have the HR1, the big beautiful bill, and some federal policy changes happening. For the state budget changes, we have the Medi-Cal adult expansion freeze that just happened January 1st, 2026. And again, we're going to talk deeper into each of these changes here on subsequent slides here. But the reinstatement of asset limits, again, that was just implemented 1/1/26 as well. We got the dental benefit changes that we're just touching on, and then we have the upcoming Medi-Cal premium changes. And then under the federal policy bucket, we have the 6-month Medi-Cal renewal change that will be happening. We have the community work engagement requirements that are going to be happening, both of those 1/1/27. Retroactive enrollment changes that are happening in the future as well as the eligibility restrictions for certain qualified non-citizens, as well as the cost sharing changes that are going to be happening. And as you probably know, as well as a lot of these changes are occurring for the ACA expansion population, category M1 here in the county. Next slide, please. Okay, so let's kind of get into the meat and potatoes here. And we'll start with the changes that have occurred 1/1/26. And again, that's the Medi-Cal adult expansion freeze and the reinstatement of asset limits. So for the Medi-Cal adult expansion freeze, what that is looking at is for adults age 19 or older without satisfactory immigration status. If you're a new applicant after January 1st, you're only going to be eligible to restricted scope benefits. Anyone that was receiving benefits prior to 1/1/26, you're going to continue to be eligible to full scope Medi-Cal benefits. There's another caveat there that we're coming up on the end of that, but if you lost eligibility, if you were receiving benefits and you were getting full scope, and then you lost benefits, there is a period, a 90-day period, that you could cure that discontinuance and continue to be eligible to full scope benefits. Let me touch on what restricted scope benefits look like. That covers emergency-related services, pregnancy-related care, including prenatal, delivery, and 365-day postpartum care, and long-term care services. All right, just want to make sure that I cover that. And again, appreciate you guys are tracking any questions or hands being raised. But significant change here for California, and that is not part of HR1, that was part of the changes made by California itself. Asset limits, again, implemented 1/1/26. And this is also limited to certain adult categories. This is for adults 65 and older, people with a disability that could be either physical, developmental, or mental, people living in a nursing home, and families where their income eligibility is determined outside the federal tax rules. The asset limits is at $130,000 for each person, for individuals, one person, and then an additional $65,000 for every additional person up to 10 people. Now, I did ask the team yesterday if we have experienced any discontinuances related to asset limits as of 1/1/26. And in San Bernardino County, we have not discontinued anyone for asset limits in the first couple months of 2026. All right. For the dental benefit change, which we touched on earlier, this is eliminating or restricting for adult Medi-Cal members. And this is for the ACA population. So 19 plus without satisfactory immigration status. I want to flag for you though that the dental services for children, pregnant individuals, and others remain largely intact through these benefit rule changes. So again, this is our ACA population that are not meeting satisfactory immigration status, that the dental benefits are being eliminated or potentially restricted. Okay, the last change on here that we want to dive in, again, it's the eligibility restriction for certain qualified non-citizens that are going to be effective 10/1/26. And these are restrictions for certain qualified non-citizens. The federal definition of qualified non-citizen will change, and they're going to be excluding some immigration categories that have been previously considered satisfactory. Team, do we have any questions on this slide? And again, this slide and the next slide are going to kind of be the meat and potatoes of the changes that are occurring in 2026 through 2028. I'm happy to pause and pepper Brent with questions.
There are no questions in the chat, but if you guys want to ask something verbally, please do, or raise your hand. I don't see anybody. Okay.
James, I have a question.
Okay, sure.
Fred Mendoza. Fred, how are you doing?
Sir, good. How are you?
I'm doing super amazing. Good seeing your name out here.
Absolutely, sir. I really like your presentation. Protocol.
Hey, Fred, let's manage expectations. We're halfway through. Great.
I want to know what the outcome is going to be for protocol patients, non-residents discharging to rehab, subacute, long-term care. Actually, subacute, our traumatic brain injury, for an example.
Mm-hmm.
Is protocol still eligible? MC13?
Brent, do you know that? Did we stump Brent already?
No,
do you need to take that offline and go back?
Protocol is not changing.
Thank you.
The main thing with protocol with the MC13, the form is going to be updated. We've seen drafts of the form. We've not seen the finalized form. It's just making sure that the individual that's claiming protocol does understand the process and the impacts that they are reading through the form, signing the appropriate box, and sending it through. Technically, on a federal level, protocol is not recognized, but California will still continue what we have been doing for protocol. That's not going to change. It's just a lot of protocol stopped because we didn't have to do protocol because of the expansion for the adults expansion and the older adults, all the stuff that we have now undone with the expansion freeze.
Okay.
So the policy never changed.
I understand that for us at a hospital, we just can't keep the patients in the hospital forever, and we want to discharge them. So thank you for clearing it up. Appreciate it.
Yep. Yeah. Luckily on that, the policy did never change on protocol. It's just that it wasn't as forward because of the fact that they could apply for regular long-term Medi-Cal because of the expansion.
Correct.
And now that we've undone that due to funding, they can go back to claiming protocol.
Thank you very much. Appreciate it.
Fred, thank you for the question. Appreciate that. Brent, thank you so much for the response. Okay, next slide, please.
We do have a question in the chat.
Oh, yes, sir.
I'm watching. It says, will patients without satisfactory immigration status still be able to renew if they meet income requirements? And the answer to that is yes. As James said earlier, our biggest concern on a lot of this is someone losing eligibility due to a procedural reason of either not completing the renewal or not turning something in. If they remain eligible, they will keep their eligibility as of now, unless something changes with the next state budget, which we can never predict. We don't know. And we do have a new governor coming. We don't know who it'll be or what their decisions will be. But as of now, as long as they continue to provide the items needed for their annual renewal or 6-month renewal, depending on what category they fall into, they will continue their eligibility and they will keep their what's being called full scope without dental that goes into effect as of July of this year.
Well, another great question. I would say that the January 26th budget doesn't mention any additional cuts but we'll have to see what the May revise looks like. But again, the January does give a pretty good indication. The May is much more of a solid budget of what we can see in June. But again, there was nothing in the January 26 budget. All right, so changes for 2027 and 2028, and the three really significant ones. Well, all of them are significant, but really super impactful. The ones occurring 1/1 to 27. We touched on them a little bit. We got the 6-month Medi-Cal renewal, introducing that requirement, the work community engagement requirement, the retroactive enrollment, retroactive Medi-Cal enrollment. Right now, we're at 3 months. With this change, 1/1 to 27, we're going to be looking at most folks are going to be reduced to 1 month. 1 month of eligibility. There's going to be some that are going to be eligible to 2, but most of the folks are going to be reduced from 3 down to 1. And then we have a change occurring July 1st of 2027. That's Medi-Cal premium changes, as well as cost sharing changes happening October 1st of 2028. Now, let's go ahead and dive a little bit deeper into each of those. And we'll start off with the 6-month Medi-Cal renewal requirement, again, 1/1 to 27. And this is for, again, a lot of these changes are related to the ACA expansion population, the M1, which is a large population. That is our 19 to 64 folks that are receiving Medi-Cal, and they will now start to be required to not just do their annual renewal, but a semi-annual renewal. So we know that anytime you introduce these kind of requirements, just like how we used to have way back, well, it hasn't been that long, but we used to have mid-year status reports, MYSRs. When you add in additional requirements, are going to be folks that don't participate. And that's where, Allison, you talk about really, making sure that we are leaning into our networks and getting messaging out. This is going to be incredibly important to get this message out. We're going to talk a little bit about what DHCS is doing, and we're going to talk about what we're doing as well to help get that message out there and lean into our networks and get that message to our community so they're aware of these changes that are happening. The work community engagement requirements, again, beginning 1/1 to 27. Again, it's for that ACA 19 to 64. They're going to be required to meet certain work requirements, training, volunteer, or community engagement. Now, there are exceptions to this. Exceptions include children and youth, adults age 65 plus, pregnant or postpartum individuals, parents with children under the age of 13, people with disabilities or serious health conditions, American Indians, Alaskan Natives, recently released incarcerated individuals as well. And I already tackled the changes that are going to be made to the retro. Remember, existing is 3 months, come 1/1 to 27. That's going to be reduced down to 1 month for most individuals. There will be some folks that are going to be eligible to 2 months retro coverage. So example, and I say that I'm just assuming everyone knows, but if I come in today and apply for benefits for myself and my family, I am able to ask for 3 months of retro Medi-Cal to cover James Vincent being seen at the doctor's office in February 2026. Come 1/1 to 27, I'm only going to have the ability to ask for retro Medi-Cal for 1 month prior to my application. The Medi-Cal, so those are our 1/1 to 27 changes that are occurring. The change that are occurring July 1st, 2027, the Medi-Cal premium changes. And this is folks without satisfactory immigration status, age 19 to 59, a little bit different there. They're going to be required to start paying monthly premiums, $30 per person per month, to retain their full scope Medi-Cal eligibility. If they do not pay their premiums and they don't pay it within a 90-day grace period, that coverage is going to be downgraded to restricted scope Medi-Cal. There are exceptions to that as well. Exceptions include pregnant people, children under the age of 19, and adults age 60 or older. And then lastly, the change occurring 10/1 to 28, 10/1 to 27. Sorry, 10/1 to 28, got the years mixed up. Cost sharing changes. And this is again for the ACA expansion population, and these are for individuals that have greater than 100% income over the FPL, the federal poverty level. They're going to start to be required to pay $35 service fees for non-essential care. Essential services are going to be they'll remain free. but for non-essential services, there's going to be that co-payment of $35 per service introduced come 10/1/28. Next slide, please. And so DHCS, and it's, you know, I feel very lucky being California. We got great state partners, DHCS, Department of Healthcare Services for the Medi-Cal program. And, you know, we earlier touched on CalFresh and CalWorks, California Department of Social Services, CDSS, another great state partner that we have. And DHCS is going through pretty comprehensive outreach campaign to get that message out about these changes that are coming up. I know they just started also a text message campaign. I think they started that in January 2026. So I think it's super critical that the 58 counties really understand and know the roadmap that DHCS is taking so we can complement that marketing strategy. We want to make sure that our messaging is aligning with DHCS. Next slide, please. And so we talk about that, right? We talk about how do we here locally in San Bernardino complement the outreach efforts by DHCS. And you know, we were having a conversation offline, and you know, this is not the first time that we've experienced significant changes like this. So we go through a pretty comprehensive exercise locally here to identify what are some of the levers that we need to pull to ensure that staff are ready and trained, existing staff, as well as new staff that are going to be joining us. And how do we come up with that comprehensive outreach campaign to get that word out, right? And there's a lot of different levers that we're looking at, from our interactive voice response system, which I think that there is a slide later on that. We have customer-facing dashboards in every single one of our public-facing offices. And again, we touched on, you know, the average number of folks coming in, 4,300 individuals coming into our TAD offices. We have press releases, we have county updates, we have social media, got a pretty good presence on Facebook and our external website, A-frames. There's just a menu of different marketing strategies that we're looking at pulling the lever on just so we can get that message out. So the more that we can educate the community, the better prepared everyone's going to be with these changes. And talk about collaboration, I mentioned it earlier, is that really leaning into strong networks and the folks that you work with, right? And I hope that's one of the next steps and follow-up items, because we talk about like this kind of presentation, and we want to do more of these kind of presentations that get the message and get the word out, is that if you're able to share with Allison your network and folks that are still, if you're interested to hear more about this, so you can, you know, further kind of cast that net into your networks, would be really super helpful, super helpful. But again, this is all just touching on what we're going to be doing locally here to message the community and message the customers. And we have a really talented group that is driving this. Next slide, please. This here is just a list of different medical resources, Medi-Cal resources available to everybody. You got the keepmedicalcoverage.com, .org, excuse me, and that's through DHCS. Now you got Cover California and also Benefits Cal. We actually have a couple slides on Benefits Cal, which is a really neat online portal that all 58 counties use here. Next slide, please. And I think that does bring us to Benefits Cal. Cool. So Benefits Cal, I'd mentioned it's an online portal, helps folks apply for benefits and manage their cases. They're able to do a lot on Benefits Cal. And I think I got like 3 or 4 slides on Benefits Cal, and the last one is really going to be kind of a call for action if you're in a position to assist folks in applying for benefits. And it's truly a win-win, especially for community-based and faith-based organizations. If you're ever pursuing kind of grants, to be able to track the success that you have in helping community members, gives you a great dashboard to be able to help to track the disposition of applications. But next slide, please. So some of the features, and this is available in 20 different languages. You can report changes, and one of the slides is talking about like self-service options. You know, we're all very much glued to our phone, our tablets. You know, being able to do transactions via your phone through the Benefits Cal portal. Is super convenient for everybody. You're able to view your benefit information, upload documents, which I think is a really cool feature. The STAR 7 is the semi-annual report for CalWorks and CalFresh programs. And again, to my earlier point, no one should be discontinued related to just a procedure reason. Unfortunately, we do experience folks losing eligibility for CalWorks and CalFresh because of an incomplete or non-receipt of a STAR 7. So being able to submit that through Benefits Cal is a great way to submit that to the county. You're able to receive messages, confirm appointments, just a wealth of different features available on Benefits Cal. All right, and this was a slide. Next slide, please, Allison. Thank you. And then this is a slide I was briefly touching on earlier. And if you're not set up as a CBO on Benefits Cal, you can email me, put it in the chat. Love to connect with you offline because there is actually a separate presentation that we go through. Lena is the person, she's a regional manager here, and she does amazing work with the CalSolace project. But she will give a separate presentation on how to set that up. And again, great way to help the community and be able to track the disposition of the applications that you're helping out with. And it will tell you whether they're pending, whether they're active, whether they're denied. But it's a great way to, again, it's a win-win all around. So again, if you're interested in learning more about becoming a CBO partner, please let me know. All right, and next slide, Allison, please. And then we got the self-service options. Again, I mentioned that we got 19 public-facing offices. We have 22 offices total. The other offices are called processing centers, and our customer service center or call center. But each of our offices have at least one kiosk, with the exception of 29 Palms and Needles. Those are very two small offices, and logistically, we can't just have a kiosk in those lobbies. Actually, Fred at ARMC has a kiosk as well. But a great way to be able to conduct business, be able to go in there, upload documents, check in for an appointment, request a Medi-Cal Big Card, request an EBT card. But a great way to facilitate and do some transactions with the kiosk. You got electronic notifications. I will spend more time on text messaging. That is just a great way to get information. And we actually track the number of folks that are discontinued related to REs and STAR 7s. We identify the folks that are registered and are receiving text messages compared to folks that are not. There's about a 30% difference between if you're getting text messages and being able to successfully navigate the STAR 7 and RE requirement compared to customers that do not receive text messages. So getting a text message and a reminder saying, hey, your STAR 7 is due. Hey, we got your STAR 7, it's completed, and we now processed your STAR 7. Or we got your STAR 7, it's incomplete. Same thing with the renewals. It's super powerful. It's a great way to be able to communicate with our customers. So text messaging is a super powerful tool that we have. Next slide, please. All right, and then the IVR, touched on this a little bit earlier. It's part of our customer service center. We use the IVR for a lot of educational opportunities as well for customers. We'll put helpful information and reminders on the IVR hold message. But the IVR itself is an automated system. Customers can call it 24/7 and get critical information through the IVR. And again, it's also a pathway to where you can speak with a CSC agent. But calling the IVR, again, it gives you access to, as long as you authenticate, customers have to authenticate, it gives you access to your case information, and then also, again, another pathway to speak with a CSC agent if you need to. Again, available 24/7. It's a great way to gain information. And I think that might bring us to, others, questions. All right, I'm going to pause. There.
Right. Folks, I'm not seeing any more in the chat right now, but does anyone want to raise your hand and ask and try to stump Brent?
That's right, Allison.
Yeah, we got to keep that Eyes on the prize there. No? No questions,
Fred,
folks?
Fred, you're coming on camera. There we
Yeah.
go.
I have one more question, James. Sorry. So, as a CBO, we have access to use scanners to upload to the cases directly. Did I understand that right?
I believe so, Fred. Let me confirm with Lena, and I'll be happy to connect with you directly, and then I can share that with Allison as well. But as organization, Locurto Foundation, if I'm helping out John Doe and I'm helping submit his CalFresh Medi-Cal application online, that I should be able to go in there and upload documents as well. Let me confirm that. Let me confirm that, Fred, and I'll
Thank you,
share
sir.
with Allison as well. Brent, I don't think you know that one.
I agree with you. I believe it is possible because I think especially with the Benefits Cal account, you have
Yeah.
a special CBO account. And then part of the advantage of that is it allows you to access the case with the information, and then it identifies that it's the CBO. You don't have to go in as the person. You don't have to have their password, none of that stuff, because that is still their password to be able to do their stuff. You have a CBO account, and you should be able to upload documents through there.
Yeah.
Because I know with your phone with Benefits Cal, you can take pictures and upload that.
Correct.
So
We'll
My
confirm
question
in.
was on the reevaluations, we can upload them instead of standing in line at the kiosk. It's just another point of accessing,
Yeah.
independently.
Let me connect with Lena offline here, Fred. And again, I'll message you directly, and then Allison, I'll share that
I
response
appreciate it. Thank you.
with you.
That'd be
Yep.
great, and we can include that in our outgoing follow-up information. And we do have a couple of comments here, both. Hi, Wendy Martinez. It's good to see you today. And also Alejandra Arias. They would like some more information on becoming a CBO partner. James, how can they email you? Do you have an
Yeah, let me
email?
put, and John's got a hand raised. I'm going to put my email address in the chat.
Okay, that'd be great. And then, ladies, why don't you go ahead and email James directly, and he'll get you set up that way. And if you ever have any problem, just go through us here at the Medical Society, and we'll get you connected as well, and then reach out to James.
Cool. Okay. There's my email address. Thank you for that. And John, you have a question, sir?
Yeah, so I'm not going to try to stump you or anything like that. But as a specialty provider, like where do you need our support? This is going to be really important for us, as you can imagine, when we schedule a visit and then we want to do a surgery. There could be a gap in time between prepping the patient and getting the authorization. They could inadvertently fall out of enrollment. So we're very interested that they stay enrolled. So where do you see us supporting this in what form or fashion? Kind of
Thank,
boots on the ground, like where do I train my staff, or what's the next steps for us?
Yeah, thank you for that, John. I think a couple fold. One, if folks are interested in having these type of presentations, especially in the upcoming months, we have a work group, and Fred's part of that work group that's forming, that's going to be getting out to the community, doing some roundtables, and doing some more, to your point, John, boots on the ground engagement. So we're going to be getting the message out to a broader swath of the population here. And I think that would be super helpful, is that if you're able to allow us to have Allison be that conduit to be able to send information out and invite folks to these subsequent trainings, as well as the second point there is we're developing outreach literature, right? So social media posts, flyers. If you in your organizations are able to help share those social media posts and post flyers to your social media and external websites, I think that would be super helpful. Again, it really does go back to, how do we educate the community on these upcoming changes? So the more that we can train the community, and the more that we can broadcast these changes through social media, I think the better position our community is going to be to kind of go through these changes.
Yeah, and just to add a little bit to that, I think the hope is that many of the primary care facilities and the doctors are going to have some type of messaging in their office, but
Mm.
having it also with the secondary providers who are providing surgery and stuff like that, just as a reminder. That's really the biggest thing. Also leading into the question that I see in the chat, usually if they're discontinued for whatever reason, there's a 90-day period to where we can restore the case and go back to as if it never happened in a lot of ways. And so if we come up to the time where you're getting ready to prep the surgery and they're aware, like, oops, I forgot this, we can get it fixed relatively quick. It usually batches to the state med system overnight, but the worker has to get the information. And so a lot of it is the communication, like James said, about the text messaging. It's the reminders. Medi-Cal renewals go out 2.5 months before they're actually due. So they get a big packet in the mail. They know it's not due yet. They set it to the side. It's easy to forget. So these targeted text messages do help a lot. And I'll touch on the question real quick in the chat for the clients without satisfactory immigration status, if they lose their coverage. So here's what happens. Again, just like the not turning in your renewal packet or anything like that for procedural, if these are individuals who did or didn't turn it in for whatever reason they were discontinued, there is a 90-day time period to where if it's a procedural reason during that 90-day time period, they turn it in, we relook at the case and we go from there. If they're discontinued for, let's say they're over income, we would still discontinue them from the Medi-Cal. If they come within that 90 days because something changed, like the income reduced, then we would relook at the case and look at being able to restore them back to the full coverage. Unfortunately, after that 90-day time period, if their income changes 6 months down the line, at that point, they're now in the fact that they've exceeded that time period, they're going to go back to restricted coverage. That's what the state law says.
Okay, so there's a follow-up question here, and then I do want to go back to John Perante's question in a moment, but the next question is from Gilda. Thanks, Gilda. Worried for the many individuals who will lose Medi-Cal coverage, especially those that are satisfactory immigration. It'll cause them to go to the ER, of course, the perpetual problem, when they could have gone to PCP. That's been an issue before this happened. But now, what are your comments about that?
Yeah, that's our biggest fear, right? Is that folks aren't going to be aware of the work requirements or aware that the semi-annual renewals are being introduced and that the coverage that they lose coverage. And I've been having conversations with Fred's boss over at ARMC, Andrew Goldfrack, about where do folks happen? What happens when that loss occurs, right? There's absolutely a ripple effect that folks are going to go to the emergency department. What happens with the Department of Public Health and Department of Behavioral Health? These are folks that all rely on Medi-Cal coverage. So I don't have a great answer for you on that, but that is what they would be leaning into is instead of that preventative care approach is leaning into emergency departments. And there's a lot of advocacy right now at the state level because pre-ACA, we had indigent programs that helped folks that were then subsequently covered with the ACA expansion. We had the low-income health plan here in San Bernardino County and all 58 counties. That is a statutory requirement that counties are required to provide care. So I don't have a great answer for you. I know there's a lot of advocacy and discussion happening, not just on the DHCS front, but the advocacy groups that the hospital associations use and lean into. It is a big item for the California Welfare Directors Association, so they understand that ripple effect that happens with the potential loss of healthcare coverage.
So thank you.
It's different but similar, and I'm so sorry, Allison.
No, go ahead.
Same
Please.
but different when we were talking about potential loss of healthcare benefits when we were experiencing the Medi-Cal unwinding during the pandemic, right? Is that for a couple of years that there was a complete pause on discontinuing individuals from Medi-Cal. But there was a couple of exceptions to that. Death, moved out of state. I think there might have been one or two others, but when those waivers were sunset and we had to go through the Medi-Cal unwinding, very similar, really making sure that we were getting, creating partnerships, getting that message out, making sure that the community knew that Medi-Cal renewals were getting put back in place. because there were paused for many, many years, and that they were reinstating discontinuances. Different but similar, that we really need to make sure that we're going through a very comprehensive process to make sure that the community is aware of these changes.
Thank you for that, James. And yeah, this gets into the whole, as you guys know very well, this gets into the whole ongoing issue, especially as James mentioned with the expansion of the ACA, a shortage of primary care physicians in the region. And when that happens, patients do not have a doctor that they can go see. And so what happens is the ERs get overloaded, overcrowded, and now this is exacerbated by the fact that with the reduction in the managed care organization tax, which is a tax is triggered by, having the federal government offered support, that's going to be reduced now because of HR 1, that the healthcare centers and the hospitals are going to be receiving less funding. We see a lot of hospitals on the brink here. So this is a double whammy. And so not to be all doom and gloom, but that's why what James and Brent are saying, you guys have to educate your patients. You absolutely have to educate your staff and patients about the importance of getting enrolled. And you may have to increase some procedures within your offices and adjust your workflows to add a component where you're making sure that they're staying enrolled and signing up for these work certifications. And James is going to speak to this much better than I, but I know from our perspective that is absolutely something you've got to take seriously and be a part of if you want to continue to see patients come through your doors. And we also want to thank Jody Wingo, who is CEO here of our community health centers. And Jody mentioned that our FQHCs will continue to see anyone regardless of status and if they use insurance coverage or have no insurance. And so thanks, Jody, for that comment. Okay, and I want to go back really quick before I let you guys go on. John Peranti, thanks for talking about what are the most important messages we can communicate to our patients. I think what we just talked about is one, but these boots on the ground sessions you're going to be doing, James, that's really huge. We, as you alluded to, we would love to stay in contact with you and have a regular system of communication where we can distribute this, disseminate it, and amplify it, if that's okay with you. And
Oh, Allison, I'm sorry to interrupt. I'm super.
yes.
There's no way you're going to be able to get rid of my email address, because now that I have your information, I'm definitely going to be sending you a lot of the stuff that we are working on locally here, so we can again send that to the network. And when we do the roundtables and have additional trainings, really appreciate that I can use you as that conduit to get that message out to the masses here. But really appreciate your support.
We'd love to partner with you on that. And it helps both of us and it helps all of our physicians and patients most of all. So if we're going to be connected at the hip, there's no one I'd rather work with. So thank you for that. Okay, and then Gilda also mentioned any flyers with this information so we can give individuals in the community, especially the ones with satisfactory immigration status, any updates about things they do need to do. So I think you mentioned you guys were working on the flyers, James.
Yes, but we do have a couple that I can send to you. And Allison, do you mind if I send that to you and then you can share that with the team?
We'd love it.
Okay.
We'd love it. We'll just establish a protocol through our medical society, so everyone hears this now, that we will send this out regularly to you all and to our community partners as well as our providers. So yes, let's plan to do that.
Yeah, we do have some flyers. I know currently on like the changes to the expansion freeze and I think the asset limits for some of the federal changes that are taking into effect next year. That's part of what the work group's going to be working on, is kind of the general flyer. And part of the problem is if we send stuff out too early, it gets lost in the shuffle.
Yeah.
So we're probably looking around June, July for us to start flooding, because then it's only 6 months. It's not a year.
Yeah.
And it also gives us the opportunity to see what the state budget, because the state budget has to be finalized. So it gives us the opportunity to see the finalized state budget, because there are some impacts there that we discussed the fact that in October of this year, there's a change to the status for some qualified non-citizens. They are currently eligible to federal funding. In October, that's being removed from them. Well, California hasn't fully decided what we are doing with them yet. We won't know until the budget's passed. So that's important information to get out, but we're not going to know for another 3 months what we're going to do. And then after that, by the time we know, we have only a couple months to get the information out. So we want to push that out as quick as we can once we know.
Wow. That's really incredible. Okay, okay, thank you. And another question, are these flyers for both Riverside and San Bernardino as this person's clientele is in Riverside County?
Well, the flyers that we'll provide are applicable to whether you're residing in San Bernardino or Riverside. It's going to have
Okay.
San Bernardino counties
Yeah.
branding on it, but it's applicable to both counties.
So basically it's pretty similar or
Yes.
identical, the protocols, right?
These are all changes that are going to be aligned throughout the 58 CDDs.
Okay, okay, wonderful. That's a good question though. Thanks, Bilda. Okay, go right ahead. Sorry, I hijacked your conversation there, James and Brent.
No, not at all. Unless if there's other questions, I just wanted to say thank you again for allowing me to come and spend a few minutes with you here. I really am excited for our future collaborations and opportunities to connect and share information. Again, I can't emphasize enough, this really does take everyone stacking hands, coming together, and figuring out how we can support our community to ensure that no one's discontinued for procedure-related reasons, and that the community and our customers are completely aware of the changes, and that again that we're in a position to support them and help them navigate. And then lastly, if you don't mind, I'm going to embarrass someone that's on this Zoom call. I noticed that she was on. I hope she's still on here. But we have Miss Karen Scott, who's the director of First Five. Miss Scott is, I thought she retired as of Friday of last week, but I could be mistaken. Miss Karen Scott
I did
dedicated
retire.
over 46 years of her life to San Bernardino County. She worked for TAD for many, many years. Karen and I knew each other because we grew up as operations managers at the Colton office, 2040 Woodpine, many, many years ago. But I just wanted to embarrass you real quick and just say thank you again for 46 plus years of dedicated service. And you have no idea how many families and individuals that you helped throughout those 4+ decades. And thank you, Ms. Scott.
Thank you for that, James. I'm
Absolutely.
still connected. I told you I'd still be connected even in retirement. So glad to be here. Thank you.
Wonderful. It's great seeing you.
Yeah, we're happy to see you too, Karen,
Thank you.
and congratulations on
Thank
your tenure, your accomplishments, your leadership, and I know Janice had a lovely time
Yes.
celebrating you this past
So good to
Friday.
see her. Yes, thank
Thank
you.
you for joining us today. Thanks.
Yeah, and to add to that, at one point, both Karen and James were my managers many years ago when I was a line worker.
Wow, so it's all in the family.
Yep.
It is.
All right, but thank you again, Allison and
folks,
team. I
yeah,
appreciate
do
it.
we have any other questions before we let the gentleman go here, everybody? This is your chance to ask the experts. This is our chance. I'm not seeing any other questions in the chat or any other hands raised. Is that it? All right. Well, we'll give you a few minutes of your day back. But James and Brent, thank you both so much. That was really a home run. We really, really appreciate you guys. And we will be excited to continue this partnership and just to disseminate this valuable information for everybody. Thank you for being in the trenches to really deal with all this. We're grateful to you.
Thank you, team. Enjoy the rest of your day.
Thank you,
Thanks,
James.
everybody.
Thank you.
Bye-bye.